You are listening to Personalization Outbreak, a podcast about the collapse of traditional corporate standards in today's more personalized world. I'm Llopis. I'm a leadership strategist, author, contributor to Forbes, and founder of the Leadership in the Age of Personalization movement. On this show, I'm interviewing executives across multiple sectors to find out how the balance between standardization and personalization can exist. Hello, everyone. Welcome back to Personalization Outbreak Podcast. And today we're shining a spotlight on this very enlightening reality. Listen carefully. Nurses are good for business. If you walk away from one thing today, you're going to learn why and how they are. But more than just that, they're essential for reshaping the future of leadership and governance with integrity, compassion, and vision. I mean, imagine having leaders who are not only skilled at navigating crisis, but also whose every decision is guided by ethical principles and evidence-based practices. I mean, leaders who balance precision with heart and strategy with a deep commitment to people. Boy, that's refreshing, isn't it? I mean, that's just the unique value that nurses bring, not just to healthcare, but to boardrooms across industries. Their holistic perspective transforms organizations, fostering trust and transparency and long-term success. Now, if you've never thought about this before, I have two really special guests to help us with this very powerful conversation. Two champions of this movement. Dr. Cole Edmonson, CEO of the Nurses on Boards Coalition, NOBC, and Dr. Nancy Mannion. Dr. Nancy Mannion, you're in for a treat. Wait till you hear about what she has to say. She's the chairman of the board over at NOBC, and they're both here to share why businesses need nurses, not just in leadership roles, but in teaching us about compassion, empathy, and how they both play a big role in innovation today. And they'll show us how nurses strengthen decision-making by leveraging skills like ethical leadership and people-centric strategies, and their ease with crisis management, and their full commitment to truthful governance. So before we get started, please click the like button below, share it with your colleagues, and subscribe to our YouTube channel and social media at Llopis, Nancy, and Cole. So happy to have you on this podcast today and being part of this healthcare forum. I mean, we've had some prep calls and we've had this little sidebar discussion before we started today. Live in different times today. And it's clear that healthcare is seeking a new horizon. So thanks for coming. And Cole, I want to start with you first. Cole, I've known you for several years. And I know we haven't always been in touch for several years because we were actually introduced by two different people at two different times in our journey. But clearly, you and I bonded. And why? Because you have this just natural ability to gravitate towards things that make a difference. And you care about your profession, the one that you've been a part of for years, and you can tell us about that story in a moment. But Cole, as the president of this organization, why does putting nurses on boards matter to you? And how has your past as a chief nursing officer given you the eyes to see the importance of this opportunity?
Glenn, thank you, first of all, for having Nancy and I here. We are thrilled to be talking to you and sharing a little bit about the power of nurses on boards. And for me, it is my chosen profession. It is the opportunity to make a difference, to create impact and influence. And it's something that I've lived my entire life as a nurse, is seeing the opportunities that are there before us to be able to improve not only health, but also look at how we can improve the outcomes of any organization in which we are able to serve and to be a part of that. And really, personally, I want every nurse to see themselves serving on a board or a governing body or an entity of some sort where they can live out their dream of having influence and impact on an even broader perspective of outcomes and influencing the health of people that we have the opportunity to serve.
It's really interesting that you say that, Cole. I did an interview yesterday, and part of the discussion talked about, just to keep it short and to the point, a nurse that had been serving this healthcare institution for 20 years. And she said to one of their executives, the way we do things in healthcare right now doesn't really give me that impact that I had years ago. And I'm actually thinking of retiring early and trying to almost reintroduce myself to not just maybe other healthcare organizations, but maybe other industries that can actually use the skills that drove me to be in this profession to begin with. When you hear something like that, Cole, and I know you'll probably have a thought on this too, Nancy, so jump in as well. What does that tell you what the state of nursing is today?
For me, it says that we have such an opportunity to influence outside of healthcare. It's also a place where we know that our nursing skills and experience and wisdom and knowledge, as well as our leadership skills, are transferable into other industries, and that we can bring things together in a very different way because of our unique experience and education as nurses. It also tells me, too, that there are a lot of nurses who want to have a different level of impact and influence and in different spaces. And for myself, 35 years in hospitals and health systems, 18 years of that as a chief nursing officer at 3 different facilities, and then moving into the staffing workforce technology solutions company to be able to see how I could also have a larger influence and greater impact and take my nursing knowledge and leadership experience with me to help improve my colleagues' experience every day at the bedside and support them and be there and to be innovative and to also help them advance their mission of improving health.
I love that. Nancy, what are your thoughts on this? And thank you again for joining us today.
You're welcome. And I want to echo what Cole said. It is about what are the transferable skills. Nursing comes with a full toolkit. We know a lot of things about a lot of different aspects of taking care of people, but how does that extend into our communities?
Hmm.
Where we live, where our families are, how do we help them? And I think that desire for impact is really at the heart of what nurses believe about themselves and why they've chosen to be in a profession that is about taking care of others, about nurturing others and growing others. And so they see this need out in their communities and they say, I want more. I want to do more. As a bedside nurse, I take care of one patient and I help them recover and I help them regain health. But if I can do that on a scale of a community or a state or a nation, that's an impact. That's just the magnitude of what a nurse can do is really profound. And I think nurses inherently know this about themselves, and they are eager and ready to serve in these leadership roles around our country.
It's really interesting that you say that they inherently know these things themselves. They do. But have they always known that there are resources like your organization to perhaps get them to where they want to go? Do you think that there's enough awareness that there are organizations like you that can help create new opportunities for them?
I think NOBC is a really unique organization. We have one particular focus, and that is to help prepare and to place nurses to serve in a governance role. And other organizations, that may be a part of the work that they do, but they have other aspects, clinical education, advocacy, and other aspects of organizational life. But NOBC has one purpose, and that is to improve the health of our communities through nurses serving on boards. And our commitment is we're going to help prepare them to serve in that capacity. So really, we're dedicated to governance and developing our leaders. And that is a unique space I think it's what positions NOBC in a very unique way. Do I think that we can have a broader impact and a broader footprint in the world? Absolutely. I think there's a lot of space for people to learn more about what we offer.
So tell us a little bit more about the greatest impact of the work and service that NOBC has provided to the organizations for which you serve. What have those been?
I think what we bring to the table when we have placed nurses in positions of governance is that we help organizations stay focused on who are their key stakeholders and who are their beneficiaries of the work that that organization is about. For example, do we really know who the community is that this organization serves? And what does this organization do to help its service help people achieve their goals? So every decision that a governance body makes needs to be seen through the lens of how are we serving our stakeholders? How are we improving our communities that we impact as an organization? And I think nurses, because of the way that we have been educated, the way we process information, the way we approach problem solving, makes us really capable of being very focused on asking the important questions about how to keep an organization mission driven and not be battered about by the external forces. And we all know there are a lot of external forces, around organizations, around our communities today. And that the nursing lens really helps to keep people focused, keeps that organization on its toes.
Nancy, I'd like to come back with you with another. I'll tell you what the question is now is, and I really want to understand when you say process information, how do they? Hold on tight before before you respond. The reason I'm asking this question is, fortunately, I sit on a couple of boards and I observe and provide guidance to others who chair boards. And I find it interesting that there's so many board members today that maybe not, that they may not be so in touch with the changing world around us. And so, what does that mean when they uh, keep contributing based on the things that they know? There is risk that they may not see the opportunities for others on boards because they don't really know what they bring. And so, what NOBC is doing here is you're changing the paradigm for this particular function of nursing and helping broaden the opportunities for people to truly understand what makes them distinct beyond the obvious that adds instant value to governance in the objectives that boards have. So, with that in mind, you see how I teed that up for you. What is it that how do nurses process information differently? And I think this is important because of what? There's so much noise. It's easy to get lost in the information than find the real value in the information. So how do they do that differently?
Part of basic nursing is what we call the nursing process. It's a simplistic approach, it's not complicated, but it begins with an assessment. You do a little SWOT analysis. What's the information that I have at hand? What's the objective information? But I also consider the subjective information. What am I seeing myself as an individual in a governance role about the community, the service, the impact, who are we treating? So I do this assessment. First, gather information. What does the evidence say? What is the financial status, right? So all of that comes together to create an assessment, strengths, weaknesses, opportunities, and then you develop a plan. That's when you start to put together what should we do? And then, because nurses are very action-oriented people, we implement. And then we look at what we did and say, does that make sense? Was it the right thing? What can we learn from what we did? If it wasn't the right answer, how do we go back and find the better answer? How do we enhance what we did and determine? And then we just keep repeating that cycle over and over. And that's how we interpret information. That's how we look around at what is happening. Where are the headwinds that an organization might be facing? And how are we going to address that? Based on the evidence that's out there, based on our solid intuition, our subjective thoughts about it, based on our own experiences. And then we put an action plan together and we evaluate whether it made sense or not. And we do it, and that's how we've approached patient care, and that's how we approach leadership and governance.
And Glenn, I'll add a couple of things there as well.
Please.
Nancy said, so, the nursing process, API, actually came from a business process. And so we are grounded in those processes, and we understand that as nurses. I think the other piece that adds to the ability to look at things in a very unique way and bring different perspectives and ask the discovery questions is our clinical foundation, which we all share as nurses. And we think about that, but it includes psychology and sociology, pathophysiology, pharmacology. You get across the lifespan for people and understanding how human development happens. And so you're approaching these things from a very different perspective of being humanistic and thinking about the sharp end of the decisions that are made, not just the blunt end of the decisions that are made. And as Nancy so greatly described it, I always say that when everyone else is playing checkers, nurses are playing 3D chess. They are really working and operating and coming from a quantum perspective because they are looking at everything around them, the environment, the patient, the family, the resources, the abilities, the capacity, their education, where they live, looking at all of those elements of this in terms of coming up with that plan and being able to then implement it and then evaluate it and go back to the assessment phase. So coming from that business process, which was originally there and was then adapted into a nursing process, it really starts to build a foundation differently for why nurses are good for business and why most nurses are good at business. And they have the opportunity then to make impacts beyond the bedside into the C-suite and into the boardroom and into the communities.
Well, I'm going to take a stab at this. So here's what I just heard. I heard that people don't know who nurses really are. And unless you are one, can you truly value the capacity that a nurse brings? And I hope that didn't come off wrong. It's just to say, it goes back to what we see in society. When we don't know each other anymore, what more can we expect from one another? And I think this might be the same trap that nurses are faced in, because I don't think that a Fortune 500 board committee realizes that nurses have the traits of agility, change management, individuality, short, long-term strategy that they know seamlessly. So I just shared this, Cole and Nancy, because what I heard is capacities that are in high demand. So with that, Cole, what are your thoughts based on what both you and Nancy said on what the value of nurses have for boards? Right now, you're talking to a group of large, medium size organizations. They don't know the opportunity. What do you tell them?
So first of all, I would say that, and there is a place for every nurse on some kind of board, entity, council, advisory group, whether that's in your local community or whether that's at the state level or national level or even international. So you have the opportunity to serve. Once you're there, you need to be an active participant in it, and you need to be competent, you need to be confident, and you need to be comfortable. And that's where we can also help as well in terms of the resources that are there. When I talk about the value of nurses on boards, it really depends upon the board that is looking for that nurse to serve on their board. What is their product? What are their outcomes? What are their business? What is their business? What's their strategies? What are they trying to achieve where a nurse could lean in and use their expertise and experience for that? And when you get a nurse on your board, yes, you are getting someone that is steeped in health and clinical and outcomes, but you're also getting someone that understands experience and engagement and quality and finance and business and human resources. This is really part of the lived experience of nurses and nurse leaders. So it depends on what you want as a company and you're trying to achieve on how that nurse will actually be able to contribute to it. But I will say this, they will absolutely be able to contribute to it. Nurses are not passive observers. They are active participants when they are all in and when they are at the table. So, Nancy, I'm sure you have some things to add to that as well. But when I think about value, that's how I start to define it is what is value to that organization and how can we be a part of that equation for them?
Go ahead, Nancy.
I want to echo what Cole said. There is a place for a nurse on every board. There are people who are willing and eager to serve. We know that from our own database of the number of nurses who are interested in serving on boards. Our desire is to match the need of the organization with what the talent is that the nurse has. And it may be that their passion really fits something to be used in their local community because that's where their passion is. So it's part of our process to really identify what does the individual need and what are they looking to do and how do they have the capacity to serve in addition to what the organization that's requesting a nurse needs to be able to do that. So it's really, trying to broker the right person for the right position to be able to make that a successful alignment for both organization and the individual nurse. But there is so much that nurses bring because it's everything that nurses have done every day that they've been a nurse. That you talked about, strategic planning. There wasn't a nurse alive at this time who was planning to have a pandemic and to live through that. And yet nurses led the way. We pivoted, we made do, we innovated, and we just, we held the line. We kept people going, we kept people alive, and we helped people to transition when that couldn't happen. But we know exactly how to address those problems with the resources that we have available. And if we can do that in our own individual work, we can certainly do that at an organizational level, working in a governance role.
So how does a nurse find time to serve on a board? Let's say that they just want to start this process. What would you suggest?
Well, it's a question people often ask, like, how do you find the time? And I answer that with, it's about your priorities. What do you want to spend your time on? Right? And the organizational skills follow the priorities. So if I'm passionate about doing this kind of work, I want to be involved, then there are resources available to help develop you where your skills may not be in alignment, or I've never served on a board, where do I start? And NOBC offers an assessment tool. We have a model, a schematic of competencies that nurses can use to say, this is the level I'm at.
Hmm.
I wouldn't, as a novice, aim for a Fortune 500 company, but I could certainly be very beneficial with Meals on Wheels or a patient family advisory council at my local
Yeah.
hospital. Right? So there are places where everybody can fit, and then you grow. So you have the skills that you might need to serve at a different level, at a different scope of an organization. But it's all about first finding your priorities, right? Turn off the television. You'll have a lot more time, right? And it's just, we make the time for the things we want to do, the things that we want to invest in. And so that may mean, less of something that may not be as productive or generative, but the value, the reward intrinsically that we receive from investing in the things that are important to us is immeasurable.
Nancy or Cole, whoever wants to jump in, is there just a small, I don't know about case study, but an example of a nurse who made the commitment to start small and then maybe rise and get more active in, from smaller to larger boards? Anything that you can share? You don't have to mention the person's name, but just so people can understand the journey.
Well, I'll let you take that.
Yeah, I will. I'll actually just share my own. So yes, I can mention my own name. So this is my journey from the time that I started thinking about getting into governance or serving on a board. And one of the things that was so important for me is that I was in an organization where board service was valued by the executives, and it was actually promoted. And part of that was through our shared governance, professional governance model at the hospital. So as a clinician, I was able to become part of that shared governance model. And then that really got me interested in how that had influence and impact on the organization, on the profession, on the outcomes, and how we actually had not only a voice, but impact. Because if you're at the table and you only have a voice, but you're not listened to, then it's just noise. And so you need to have impact that is married up with the ability to have that voice. And so from shared governance, I actually became involved in my local chapter of the Texas Nurses Association, and then in the local chapter of the Texas Organization for Nurse Executives at that point, became an officer in those organizations, and then eventually served on the AONL board as an elected representative for the American Organization for Nursing Leadership. That led me into other areas after seeing and having that board service, that I was able to actually be on a board in Dallas for New Friends, New Life, which is an organization that does prevention of human trafficking,
Wow.
particularly among young girls and women. And this is an area that I am passionate about seeing the prevention in and stopping this as a sane nurse, as someone that actually has practiced in those areas in the emergency department and have seen human trafficking. So I was able to actually serve on their board and then actually in the incoming chairperson of their board this year. So you find ways to serve wherever you are. It could be in your hospital, it could be on a PTA board, a homeowners association, but you can see yourself growing in that governance and that leadership. And I'm a big believer that you can't get all of the joy you want in life from your job. So you need to find other sources of inspiration and joy and influence and impact where you can see that actually happening.
So based on your journey, Colin, thank you for sharing that. Um, did you ever feel like you weren't worthy to be at that table? Or did you look at it the opposite and say, wow, why didn't I take this first step a long time ago?
Yeah, it's a great question. And I think a lot of nurses can't really see themselves serving on boards.
That's why I'm asking.
Yeah, it may be time. It may be your own kind of self-image. It may be that you don't see people like you serving on boards. And so that is also another factor. It may be that you're intimidated by what a board does with strategy and finance and governance. And maybe you don't have a lot of formal leadership experience. So for me, it was about finding people that believed in me, that actually mentored me in this, that stood by my side, that gave me wisdom and advice when I needed it. And it was also about having very supportive leaders in the organization that I was in that believed in the art of governance and the power of nursing to bring those two together.
Was there an example of when you saw your formal training as a nurse come alive in a board? When was the first time you said, this is where I really was able to contribute in ways that, unless you were a nurse, you couldn't have been able to do such a thing?
Yeah, I think there's a number of examples for me, and I know Nancy has them as well. She has a lot of board service and leadership. But one of the things that I always felt was interesting is I tried to help keep everyone focused on why we're here. And ultimately, that's people and what we're doing in terms of this. How does it serve people better? How does it make the organization successful? And how do we make sure that we're actually sustainable in our mission as an organization? And bringing all those things together, I think, is really powerful when you understand who you're really serving. So oftentimes it was about asking about, are we providing trauma-informed care for victims of sexual assault? Are we providing the right type of resources for the newly diagnosed diabetic patient who's going to be returning home in a food desert? How are we actually looking at not only the here and the now, but the long-term success of the people that we are serving within the organization?
That's outstanding, Cole. Nancy, I want to give you an opportunity. Anything else you'd like to add to this?
Sometimes our leadership journey starts with a tap on the shoulder because someone sees in us what we don't see in ourselves. And that's happened to me on many occasions in my career where I felt like, no, someone else is going to step up and they're going to be better than I am because I don't see myself, with that true lens. And I want to, again, echo what Cole was saying about, finding a mentor. Someone who can help remove your barriers, whether they're external barriers by helping to introduce you to people who know people, or the barriers that we have within our own self, the shutters that we put on our eyes to say, I don't really see me, and who would want me to be in that position when indeed we have so much to offer. And so some of it, and some of the work that we aim with NOBC is to help people feel comfortable by helping them develop the competencies that they need. We are offering training that allows people to learn how to speak like a board member, that helps them to decipher the language of the boardroom the way that someone else would have to learn to decipher the language that nurses speak, right? That healthcare talk. But it really is important that we have people around us that we trust and we listen to them and listen when they encourage us to step forward. Because that's often that first step on the journey is always the hardest one. And once you get moving, it becomes easier and easier to step forward and to lean into the governance work. But at first, it feels a little daunting. But as you develop and you have success, it builds on more success. And so you go from, a small community level all the way up to a national and international level. And I've lived that journey in my own life as well.
So, Nancy, first of all, I have to off topic here. Well, not off topic. You have tremendous executive presence.
Thank
So,
you.
so what you're doing now, you're meant to do it. I mean, if I think the more people that you get around, I think you could just literally inspire them to want to go after being a board member because the way you handle yourself with so much grace, and you just have this deep uh, desire to add more value to a profession that already has it. Just so you know, that's what I interpret from you. So
Thank you.
thank you for what you're doing. But on that note, nurses, as you know, are described as balancing precision with heart. Can you share specific ways that this balance drives successful decision making in boardrooms?
Nursing has been described as both a science and an art, and that's absolutely true. And the science of nursing is what we talked about a few minutes ago, the assessment and planning and implementation and evaluation. That's a scientific process, right? That's how researchers function. But so we bring that science. We also bring, as Cole mentioned, a strong clinical background. We understand how the human body works in great detail because that's part of the work, understanding how disease affects people. But we also look at what is the psychological implications of having a disease? What does it mean to be told that I'm a diabetic? And what does it mean if I don't live in a community that has a grocery store that offers healthy food nearby? So we look at the science, but then the art of it is the human part. It is, are we doing the right thing in making a decision at a governance level? While we have all the data and all the hard facts and figures of, what happens if we make this choice or that choice, the last question is always going to be, is this the right thing to do? Are we making the best choice for the people this organization is intended to serve? And so, I think that's where nursing really brings a lot of value because we think down that line a little farther than
Yeah.
just the initial decision. As Cole said, we're not at the blunt end of the decision. We think about what happens at the sharp end, to who is impacted. And so that is the precision, but it's also the heart.
Makes a lot of sense. And I've always thought, knowing what's right isn't enough to start doing what's right, and knowing something's wrong isn't enough to stop doing it. I haven't met a nurse yet that isn't in it to do what's right. So I echo what you're saying. Now, on that point, social determinants of health, we know that they're important, but how do you address them through your board service?
Social determinants of health are non-medical factors that influence the wellness and health of people and community. It really impacts the quality of life, and they drive the well-being of the communities. And that ties directly to the mission of NOBC, which is to improve health of communities through the service of nurses on boards. So things like access to healthcare, developing healthcare literacy, addressing food insecurity, access to education at all levels, and economic development. Those are keys to good health in communities. It's not just about having a hospital in your community. It's about all of the other things that support keeping you healthy. And we track that with every board placement that NOBC does. We go back and evaluate what social determinants of health are being impacted. And I'm proud to say that access to care, education, health literacy are in our top three of the work that NOBC is doing in terms of the organizations that we are aligning with and also the impact that those nurses are having. Those are the things that they are serving and trying to impact. So we're very proud of the fact that we are linked to this. This is an international standard. Social determinants of health are worldwide. They're not limited to the United States. And so this model of nursing governance in communities is really replicable.
Now, how do you take all these skills and uh, that come naturally to us at the bedside and transfer them to non-healthcare industries? How does this play out?
Go ahead, Cole.
Sure. So I will give you my own experience and then what I've seen with other colleagues as well. As clinicians, and that really being our foundation and having the nursing process and being really steeped in the social determinants of health, but also understanding how disease happens and looking at the environment that people are in as well. I think all of that translates really easily into other sectors in terms of business or industry, banking, other areas. And I also say every organization has a workforce. And they want that workforce to be healthy and well and present, and being able to be productive and achieve the outcomes they want and to have joy at work. So there's not only the patient side of what nurses are doing in population health and caring for patients, both the individual and the people, but it's also about how do you keep your workforce healthy? How do you keep them engaged? What are the things that you need to provide for total wellness in terms of this? So there's just an easy transition of those skills and experience and knowledge that you've gained over time and those frameworks that come into business that help you to start where Nancy said, assess the problem, what's happening. Also then make a plan for it, implement it, evaluate it, and return that to the assessment phase and then go forward. And a lot of nurses, we do a lot of diagnostics as well. Even though the API process for nurse practitioners really includes the diagnostic piece of that. So they're actually assessing and diagnosing, planning, implementing, and evaluating as well, more in the medical model. So there's such a beautiful synergy of skills and connection and opportunities for nurses to be able to translate those into other industries. A number of our colleagues serve on other boards that are private equity boards, serve on community health center boards. They do serve on Fortune 500 company boards, and they're able to bring that perspective to ultimately what is the value of what we're offering and how is it bettering humanity? And how are we actually making a difference in the lives of individuals and people and populations?
You got to where I was hoping to go. And so thank you, Cole. But are there particular industries that you're seeing these transferable skills play out the most? I mean, you said banking, private equity. Are there others?
Yeah, what I see, Nancy, is the opportunity for nurses to serve just anywhere and everywhere. But I will say that I think there's more demand happening, particularly in technology. And this is a really important space for healthcare, but every other industry as well, as it's kind of driving who we are and how we do things and the time that we have, to your point earlier. And thinking about how those technologies are being developed with nurses, with clinicians, or even by clinicians, but not being developed without them and then handed to them and saying, here's your technology, go use it. Right. So getting on advisory councils, getting on committees, getting on boards of technology companies is one place that I think nurses can have a huge impact, because so much of technology is designed towards health and is in hospitals and health systems, and then even in communities and the post-acute areas as well. These are going to be drivers of health for us and our outcomes. And without your health, how do you actually create wealth for you, your family, for others? if you're not healthy, you are not necessarily able to be your full self, be present, and have really the most productive life that you want to have. So I think technology is a burgeoning space for that, and AI companies, technology, and then of course, in other areas that are focused on healthcare.
So let's wrap this up by talking about some of the major achievements at NOBC. Correct me if I'm wrong, but it's already expanded its reach to over 39 million people. Is this correct? I mean, what strategies have been most effective in achieving this?
We have a lot of partnerships with organizations that support NOBC. And one of our bigger partners is the American Association of Retired People, AARP. And they have, as you know, they're one of the largest associations in the world. They have millions of members. And so the work that we do with them gets in front of them. And that's a good audience
It's a great
because
audience.
they are, as we know, a very responsive group in terms of the membership. They're very interested in healthcare, particularly. They are, but they have also been, they're looking back with a lot of wisdom,
Hmm.
and they're very connected. So there's a lot that we are grateful for in the way that our partners help to spread the word within their organizations. We have 27 member organizations made up of other nursing organizations. So all of their members are part of NOBC. So that's where we get our large reach of almost 40 million people that hear about us and understand the work that we have been doing. But I want to go back to, what have we done since inception? We have been an organization now for 10 and a half years. So last year we celebrated our 10-year anniversary. And when we had the opportunity to reflect on our past, our very humble beginnings that began after a Robert Wood Johnson report on the future of nursing that was released in 2010. And it said, this is the scope that nurses have. This is how much more nurses can do. Work to the top of your license. Expand your reach, have a vision. And there was a group of people who had a vision and said, you know how we're going to do that? We're going to have nurses serve on boards because they can influence and they can be impactful. And so out of a very humble beginning, under the wing of another organization, NOBC was formed. And today we have achieved over 11,000 board placements from small organizations and communities to international and Fortune 500 companies. We have established an international agreement with an organization in Africa. And we have produced a micro-credential course to prepare nurses for board service called Language in the Boardroom. So we have been very busy, but we also know our future is even brighter. We won't rest on our laurels for very long.
So with that in mind, and I'm going to ask both of you to answer this question, where do you see the future of NOBC here in the next 5 years, Cole? What do you see?
I'm gonna give you 5 things that I think are going to happen in the next 5 years, and I agree with Nancy. That this organization has had such a tremendous success, and it's because of all of our partners, our strategic partners, our member organizations, and our sponsors that are there. It's true coalition work. I'm all for the love of the mission. But as I see us thinking about moving forward, one of the things that we are thinking about, to Nancy's point, is how does this work translate internationally using a global health framework? Because there are 23 plus million nurses around the world, and they also want to serve on boards and have influence and impact. Secondly, how do we actually kind of deepen our commitment to earlier talking about other professionals that are at the board table that may be clinicians or healthcare executives that share this same desire and same purpose? How do we help them in the art of governance? So thinking about interprofessional work. As nurses, we're perfectly positioned to be a part of an interprofessional team and lead an interprofessional team. I think often about the impact of nurses on boards in this next decade. We did our inaugural survey looking at all of the different impacts of nurses on the social determinants of health and what were some of the findings in that and the challenges and the barriers and what did that demographic look like? Well, now as we move into that next decade, we need to be looking more at really ultimately what is a return on investment for an organization that says, yes, I want a nurse on my board, and we can help answer the why. We're also looking at even how can we even be more inspiring? How can we tell these stories differently? You said it earlier, sometimes nurses are seen in a certain perspective or through a certain lens. We want to change that and reframe that into the whole nurse, thinking about who they are, what they bring, in terms of their abilities, capacities, experience, and really their competencies. And then lastly, for me, is really the inclusivity piece. I want, again, every nurse to see that there is a place for them to serve on a board if that's what they want to do. And we want to tell those stories in a way that they can see their self and they want to serve and they know they're going to have the support, whether they're board aspiring, board serving, or they're board mentoring. There's a place for every nurse on a board.
I love that, Cole. Nancy?
Nurses are good for business. That says it all.
I think it really does. And I tell you, I've walked away with it with so much enthusiasm to share what NOBC does and why it's important, not just for the nurses, but for society, for business, for the advancement of humanity. So many layers of knowledge and wisdom that is often unseen because we only see them in certain environments. And what you're doing is you're helping expand the environment for their capacities to multiply and create not just impact, but a tremendous amount of influence in how their voice carries across industries and across generations who need to understand this ethical leadership approach that they bring each and every day to not just patients, but to families and societies and communities around them. Nancy, Cole, thank you very, very much for your time. Completely appreciate and just I'm just enamored by this work, and I wish you nothing but the best. And just know that you have an advocate here to support you in any way I can.
Thank you.
You're
Thank you,
very
Glenn.
welcome. No, you're very, very welcome. And as we end every show, when you lead in the age of personalization, you will see things that others don't. Do what others won't, and keep pushing when prudence says quit. Thanks for listening to Personalization Outbreak. Make sure to subscribe so you never miss a show. If you enjoyed the content, visit ageofpersonalization.com to check out our free streaming video series and learn how to get involved in the movement. I'm Glenn Llopis. I wish you a good day, and remember, without strategy, change is merely substitution, not evolution.